Good evening, everyone. I would like to thank you for being here tonight. This is the first of what will be a series of community forums. My name is Dave Condi. I'm the ministry coordinator here at First United Presbyterian. I will serve as your moderator and host this evening. Now, tonight is not about our church, but if you would like to learn more about our church, I would certainly love to tell you. All you need to do is ask. A few logistical items. Restrooms are located just down the hall. Make a right out of the sanctuary and make a right through the double doors, and you'll see the restrooms. We anticipate this forum will last roughly an hour, but if you need to take a restroom break at any time, feel free to step out. That won't be a problem. Refreshments generously provided by our sponsor, Jay Peterson and Paige Beckner with Edward Jones, will be provided in our fellowship hall immediately following the forum. During that time, members of our panel will be available if you have any questions that you would like to ask that perhaps you didn't want to ask publicly. As I mentioned earlier, this is the first of what I know will be a series of community forums. The intention of these forums is to connect the citizens who live in or near Fairbury with available community resources and information. Today, we will focus on community health care resources. We are planning forums in the future on a variety of topics with many different speakers and panels, and we hope that you will join us for them all. At the end of tonight's forum, you will have the opportunity to ask our panel questions. We do ask that you refrain from asking questions that are of a personal nature or about specific medical concerns. If you have such a question, please ask a panel member after the forum or use the provided contact information to reach out privately. In just a few minutes, we'll introduce our panel, but first we have a door prize to give away. Our door prize today, also donated by Jay and Paige at Edward Jones, is $50 in chamber cash, which can be spent at many of the businesses around town. Paige, would you be so kind as to grab the basket of fun that's sitting out there and to join me up front? All right. Ladies and gentlemen, this is Paige Beckner with Edward Jones, and if you could, and actually if I could borrow that microphone, I'm going to ask Paige just to tell us a little bit about herself and Edward Jones and who this lovely young lady is.
Okay. Hi, good evening. My name is Paige Beckner. I'm a branch office administrator at Edward Jones Investments here in Fairbury. I work with Jay Peterson, the financial advisor. I've been with Edward Jones. It'll be 9 years this June, which I don't know how I'm that old already, but I am. This is my oldest daughter. She's 6.5. Her name is Wynn, and she's a super helper with me tonight. And Jay and I are just really appreciative, for everybody putting on these community forums, and we're excited to, help bring some awareness of some services here in Fairbury. So thanks for having us.
And thank you for being a part of this and for helping your community. I think her name is Wynn, so clearly she has to draw, right?
There you go. That's the idea.
Wynn, would you mind grabbing one of these? Dig deep now, anyone. Don't get the one with your mom's name on it. That one doesn't count. Okay. Can you read that?
It's Twyla LaCure.
All right. Come on up. Oh, goodness. Congratulations, Twyla.
Thank you. Thank you.
But wait, there's more. Paige has actually told me that they have a bonus door prize tonight.
We do. We've got a really beautiful bouquet of flowers that's over at our refreshments table that you'll see later, and it's really beautiful. It's from Sims Florist. So, Wynn, will you draw another name?
Not that one.
Bruce Wisey.
All right. And we'll get that arrangement to you after the forum. Paige, thank you very much. Wynn, thank you so much for your help. I'm going to set this back down here. I'm going to set this over here. Once again, folks, thank you for being here this evening, and we hope you enjoy the forum. Okay, let me get my list of very, very, very difficult questions for these folks. We're going to start with a really tough one. Could each of you please give us a brief introduction? We'd like to know who you are, what your role is, and maybe a brief statement about yourself, your family, and your interests.
Hello, I'm Lana Likens. I am Director of Public Relations at Jefferson Community Health and Life. I have been with JCH&L for 30 years. My passion is to try to get the information out to all of you about the services that we have available and the ways that we can help the community.
Hello, I am Ashley Norden, and I am the clinic administrator. I've been in this role for 3.5 years, and I've been with JCH&L for 14.5 years. I have 2 kids, and I really enjoy healthcare and helping people, and just want to make sure that we provide outstanding customer service to everybody.
I'm Kim Shattuck. I have been with JCH&L for 5 years and in my current role for 2.5 years. I'm the business office manager, and when I'm not helping people with their billing needs and answering all of your insurance questions, my husband and I are the laziest people you'll meet in Fairbury.
I'm Erin Starr. I am the Chief Nursing Officer. I have been at our facility for 20 years. I still work the floor as a nurse. I have my weekend coming up this weekend, so I'd say my passion is still having my hands on patients and helping to take care of them and their family. When I'm not here, I'm at the high school for basketball games, which we're playing right now, so go Jeffs.
Go Jeffs indeed. Thank you. Ladies and gentlemen, could we hear it for our panel? Let's get this now before you make them mad. Thank you all so much for being here this evening. We look forward to the information that you're going to share with us. But we're going to ask you now, can we talk about some primary care? I know these days that many of us have so many specialists that we see. So is it still important that we have a primary care provider?
Yes, so it is very important that you have that primary care provider. Just having that trusting relationship with that provider helps prevent illness. They can manage your chronic diseases, chronic illnesses, acute problems, and then refer you to a specialist if it is needed and they don't feel like they can treat you fully.
So does the primary care provider act as kind of a central hub, so kind of managing the care through other specialists? So for instance, maybe preventing prescriptions that might conflict with one another?
Yes, so if they refer you to a provider, that specialist will send their note back for that physician referring provider to review. You'll have follow-up appointments with your primary care provider that will just make sure that, if there's something that was found at that specialist visit, but it isn't maybe that specialist's thing that they treat, then the provider will review that, figure out what's the next steps, and kind of go from there.
So that sounds like a big safety thing, that making it very important to have a primary care provider.
Yes.
Okay, and are there different kinds of primary care? Back in the day, I feel like we just went to the doctor, but now primary care providers aren't always doctors, are they?
Correct. So at the Fairbury Clinic, we have doctors, medical doctors, doctors of osteopath. That's what Dr. Stroklin is. Dr. Wergen, Dr. Schumard, and Dr. Narayan are medical doctors, and they are mostly the same. They can treat everything the same. They go through the same schoolings. The only difference is the osteopathic has more of a whole person approach in their treating. And then we also have 2 PAs, physician assistants, Bryce Taylor and Kensley Williams. And then we have 3 nurse practitioners, Megan Knutson and Carisha Afu and Keegan Williams. And the main difference between a physician assistant and a nurse practitioner is a nurse practitioner has a nursing background and then they get an advanced degree for that. They can both still prescribe medications, treat your illnesses. They work with the physicians, so if they need extra support, that physician is always there to support them. And then a physician assistant has more of a medical schooling, similar to like a physician, but not as in depth. And they are there to assist the physician and work alongside them as well.
So do all of those different types of providers work under the guidance of an MD?
Yes.
So even if you're not necessarily directly working with an MD, you're always kind of under the care of an MD?
Yes.
Okay,
Yep.
that makes sense. Are you guys ready for some tougher questions now? Okay. Oh, please,
One more question for Ashley.
please.
So can a person consider one of the nurse practitioners or a PA as their primary care provider that they're going to see on most visits? And could you also address, what happens if somebody wakes up sick on a Tuesday morning and their doctor they usually see or their PA or a nurse practitioner isn't available that day? Then what?
So yes, you can have a nurse practitioner or a physician assistant be your primary care provider for all clinic things, your physicals, your med refills. But if you go into the hospital, you'll have the doctor that's managing your care, one of our doctors. And we always have same-day appointments. If you call early enough in the day, we usually try to have same-day appointments. It may not be with your primary care provider. We always have an on-call doctor and then a PA or nurse practitioner that's doing acute visits, which is just kind of those coughs, colds, ankle pain, those things that just kind of come up. And they can see you usually same day. And then if they have any questions, they'll talk with your primary care provider. And so yeah, we're always there to take care of you.
Excellent, excellent. Okay, so sometimes my wife and I have a disagreement because she's, sometimes like, let's go to the doctor, let's go to the ER, whether it's, a boo-boo or someone's arm is falling off. And someone's arm might be falling off and I'll be like, they'll be fine till Monday because I know it's cheaper, right? So can you give me some examples of signs or symptoms that might require a visit to the emergency room regardless? And what kind of things can be handled by urgent care versus what can just wait for an appointment for the primary care provider?
Excellent question, and there is a flyer about this in the room. Lana put this out a couple years ago, using the ER wisely, helping to keep costs down. I think the biggest issue right now is just the rising healthcare costs. So if you're not familiar with what an ER bill is usually versus a clinic, it's fairly significant. So there are a lot of people who do use our nurses as triage. So if you call in after hours, we can try to talk through your symptoms with you and whether or not that's something that we need you to come out right away to be looked at, or if we think it's something that you can kind of baby or treat through the night until the morning. What you have to come see us for, if you have any weakness on one side of your body or you're having any kind of facial drooping, problems with speech, that we would consider that maybe some stroke symptoms. Crushing chest pain, heart attack. I mean, those are the biggest things that, big things that we see in our ER. A trauma, obviously. If you're in a car wreck, we're gonna need to check out your C-spine and probably a head. But some of the things where we see maybe some overuse of the ER might be the sore throats, might be the pain that started, that they really haven't went through the basic Tylenol, ibuprofen, heat, ice, elevation. We tend to see some toothaches. A lot of times they just, that worst pain of your life, that they got to come into the ER. But it's never for us to say that this isn't an emergency for you, but we also want to try to explain to you there is a significant difference in the costs between those two areas. You also have to think why those costs are the way they are is we run a 24/7 emergency room, which includes nurses, doctors, mid-levels, a radiology department, lab department. So that's why sometimes those costs are significantly higher. So if you do call in the middle of the night, we will try to kind of discuss your symptoms with you, try to get you through till the morning. But obviously if things, uncontrolled pain, severe shortness of breath, if you're having an allergic reaction, major injury such as a broken bone, those types of things definitely need to come out any time of the day.
And what happens if I show up to the ER on Tuesday at 1 o'clock in the afternoon, and I come to the emergency department, but I say, my elbow feels funny? What are you going to do then?
Great question. So now that our rural health clinic is attached to the hospital, we have tried to do a very good job of triaging our patients and determining right then and there whether or not it is a true emergency. So in the event your elbow pain, we would probably take a look at you, get a brief history of what happened, and then we will call over to the clinic. We will see if there's an opening right then and there and whether or not there's a provider to see them, and then we make sure it's okay with the patient. Oftentimes our patients don't realize. And I would say probably from the history of being in this town, it has been very difficult to get into the clinic if I just called in. But I think we have made strides in making that available for people. So I think we still have patients in our community who think, oh, well, I'm not gonna be able to get in, I'm just gonna go to the ER. But if you come in, we will try to make efforts to get you into the clinic right away. And in some cases, it doesn't happen. A patient might call the clinic, nobody's open, and if your symptoms sound, you know, concerning, they may just refer you to come over to the ER.
And so you said something in there that I think is very important. You said if you call in that you will provide guidance. Can you tell me a little bit about that? Who do I call and who will I speak with when I do call?
That's a great question. There's actually two parts of this. So if you call in the middle of the day, anytime, it's going to go to patient services at the Fairbury Clinic. So they now, they have a department of 3 nurses who that's all they kind of do. Well, that's not all. They do a lot of stuff, but they do a good job of triaging things. Plus, they're right there in the clinic. So if you have a question and you're like, well, Dr. Schumart tells me to do this, well, then that nurse could probably get up and go visit with Dr. Schumart then and there. If it's after hours, after clinic hours, you would just call the hospital. It goes through to our charge nurse, who is the one that's usually in charge of the ER, and they'll just kind of review what your symptoms are, when they started, how is this any different than what they were, as well as have you taken anything, or if you've done anything to treat this. Sometimes I think people are concerned, they call right away, but yet they haven't tried sometimes just the basics. And usually, sometimes the basics are really what fixes the problem.
Little chicken soup, maybe.
Yep.
There you go.
And a heating pad.
And a heating pad. You know, and so 24 hours a day, 7 days a week, we can call this number and somebody will give us advice on whether or not we should seek treatment.
Yes.
Okay, that's...
And one more thing I might add, our hospital has just okayed the purchase of an additional triage database, which I think is really neat. You know, I've been a nurse for 20 years, so my advice versus a nurse who's been in, you know, her position for 3 years might be completely different. I will tell you, it's always different. And I've had kids where another nurse might not have kids. So sometimes our triage is based on our experiences. And so this new database that we have, we can type in all the kind of the symptoms of the patient, how long it's been going on, and this database kind of formulates probably what's going on with you. And this will help nurses consistently give correct information back to you, but then we can also send this to you in an email, a text, and then we can also save it in the chart. So let's say, you know, I gave Dr. Klein some information on an abdominal pain, but then after I gave him those instructions, we sent it to him via email, and then I can save it to his chart, just in case in the morning if he calls in and he talks to the on-call provider, they know exactly what information we've given them. So we're pretty excited about that.
And what is the cost for that service?
Very minimal, because we're a rural health clinic and a critical access hospital. You know, it's less than your monthly groceries. So I'm sorry. Nothing. Sorry.
Nothing. Oh, that's a great
No.
price. Okay,
Yes.
fantastic. And I just want to say, I was a little disingenuous there because I have two daughters in their 20s, and they seem to always have an ailment on Saturday evening. And I got a call after I had learned about that number. I got a call from my daughter, one of them, I won't say which one, and she said, I think I need to go to the hospital. I cut my finger. And I said, well, when did you cut your finger? Thursday. I said, no, you're not going to go to the hospital. You're going to call this number. And she did. She called that number, and it turned out that it was able to wait until Monday, which was fantastic because it probably saved her, me, a large emergency room bill. So I really appreciate that that service is available. I think it's such a wonderful thing, and at no cost. I mean, so even if you don't have insurance, and we're going to get into that in a moment, or you don't have a lot of financial resources, this is available to you. And I think this is a great time to say, and it's really important to say that, you know, if you are having chest pains, if you are experiencing something that could potentially be a life-threatening or altering situation, by all means, you know, regardless, you're going to get treatment, right? I mean, they're going to, you know, they should come to the emergency room. They should come see you because they're going to be treated regardless of what their financial situation may be. That's fair to say, right?
Correct.
Fantastic. And so let's get into that a little bit. What about those people who are uninsured, underinsured? What resources are available to them to make sure that they can receive adequate medical care, especially those whose financial resources might be limited?
That's a really good question because there are a lot of resources out there. I have gone down the rabbit hole with this one. I really have. Just with JCH&L, for those who are fortunate enough to be able to pay in full, we offer prompt pay discounts. Those who are uninsured get a 25% discount off the top of their bill. We do also offer payment plans, 10 months, no interest. We also partnered with Union Bank up to 84 months to pay off your bill. If that's not what you need, if you need more assistance than that, we do have financial assistance available. You would be surprised. I just put one little note here. A family of 5 can make over $95,000 a year and still qualify. It is on a sliding scale. Aside from that, outside of JCH&L, you have your state Medicaid program. Every Woman Matters. We don't talk about that program enough. This is a program that even women who don't qualify for Medicaid can qualify for this program, get free mammograms, free health care. It is an amazing program. Free physical, free public exams, the whole 9 yards. There are so many things, and we're more than happy to help you sign up for all of it.
And is that, are there financial qualifications for that, I'm assuming, and there's maximum income levels, but you can guide them through that process and show them what they need to do to see if they qualify.
Absolutely.
Wow, that's fantastic. And you mentioned 10 months, no interest.
Yes.
What kind of credit score do I need to have to qualify for that program?
I don't care what your credit score is.
Really? So anybody can come in and have their payments stretched out over 10 months with no interest?
And I'm going to tell you, even with the Union Bank loan, that healthcare loan is backed by JCH&L. I don't care what your credit score is.
Really?
Correct.
So now there must be some qualifications for that. I mean, it's with...
You do have to apply. They do a risk score. I mean, if you've had a loan through there with us before and you've had that returned, you're probably not going to qualify for a big loan. You probably would have to wait. But honestly, we've had very, very good luck since we started this program. The number of loans that we've had set up, the amount of payments that we've had come through, people have been really, really good with this program, and I honestly wish more people knew about it and could take advantage of it.
Okay, so if there's someone sitting out there right now and they're thinking, you know, I've never defaulted on a Union Bank loan with JC&H, my credit score is not very good though, you would say that they probably still would have a very good chance of qualifying for that.
Come see us.
And tell me about, and maybe you don't know the answer to this, but what size loans are available? I mean, obviously, you know, if someone needs stitches, that's probably something that can be covered, but you know, what if someone needs, you know, surgery or even major surgery? Do they have loans that extend to that amount?
Yep, anything up to, as long as you can make your monthly payment up to 84 months, the minimum is $10 a month.
Wow, wow, that is great to know. I was not aware of that. So is it fair to say that for really just about anybody out there, there's a path to treatment?
Yeah, absolutely. There is going to be a little bit of work on the patient side. It's a give and take. As long as you're willing to do your part, we're willing to help you along the way.
Wow. I mean, that really is great to know. I mean, you know, I think that there are a lot of people in our community and in other communities who maybe neglect healthcare, don't get checkups, don't get the things they need, or maybe they're dealing with a pain or an ailment that they don't get treated because they simply think they can't afford to do it. But if they knew about these resources, I think that could change everything for them. That's great to know.
Absolutely.
Excellent. Now, I've heard of something called the No Surprise Act.
Yes.
What is that?
Yes. So the No Surprises Act, it actually is twofold. So the first part of it is about balance billing. When this first came out, we pretty much decided we're just not going to do that. Balance billing is when the facility is contracted with an insurance company, but maybe the provider is not, but we decide to go ahead and bill you the whole amount anyway. No, we just don't do that. So we don't even talk about that part. The rest of it, though, is price transparency. Hospitals are required to post their prices online on their website. We have shoppable prices online. You can see exactly what we're going to bill your insurance company. You can see exactly what we're going to bill you if you're self-pay. And then you're also guaranteed a good faith estimate. If you are self-pay, you should be getting this every single time for any service that is scheduled a minimum of 3 days in advance. Any service. If you do have insurance, you can ask for this at any time, and not only will we be able to give you an estimate of what will bill your insurance, but if we're contracted with that payer, we can also tell you what your responsibility will be after we've billed your insurance.
Excellent. And how close is that estimate normally to the final bill? Is there a lot of variation at the end, or is it typically fairly in the range anyway?
We're pretty close.
Okay.
The law says that we have to be within $400. We're never that far off, ever.
Really? Wow. That's great to know. And I want to back up a little bit. Earlier we had talked about someone, or you mentioned a prompt pay discount, I think it was. So let's say someone needs stitches. They come into the clinic. I'm assuming that would be a clinic matter. And, but they don't get paid till next Tuesday. Okay. So do they lose that 25% discount because they don't get paid till next Tuesday, or do they have a certain amount of time to get it paid?
Nope. So long as your bill is not in collections, if you can pay the entire bill in full, you get that 25% discount if you don't have insurance. If you do have insurance, you still get a 5% discount, so long as you can pay the bill in full.
Okay.
As long
And
as
before
it's
it
not in
goes to collections?
Correct.
Okay. So this might be a difficult question, but from the time I walk out of that office to the time it goes to collections, about how long do I have to get that thing paid?
From the time that you get your first statement, 120 days.
Okay. So, and I'm assuming that's if I haven't paid anything at all, but if I'm
Correct.
working through paying you, then I'm assuming maybe that even gets...
If you set up a formal payment plan,
Okay.
then yes, that starts your clock over.
Outstanding. Now, I'm going to get to the real tough questions now. Let's say I owe you money. I came in last year and I had a broken leg and you fixed it. Now, and I didn't pay you, and I don't have any money. But now I broke my other leg. I got to stop doing this, but I keep breaking legs, right? Am I just out of luck? I mean, do I just have to limp around with a broken leg? How does that work?
No, you can come and get treatment. As a matter of fact, we have combined our business office. So the hospital, clinic, even long-term care is all billed out of one business office now. So your registration staff in the clinic doesn't know how much your bill is. They don't know whether or not you paid it. So when you call to make an appointment at the clinic, they don't know how much you owe. So they don't know that you have an outstanding balance. I do.
So unless you're there, there's no reason to be embarrassed or afraid to call because they don't even know you owe money.
Right.
So, I mean, I feel like at a certain point, though, right, there has to be a moment where they come in and they just like, okay, man, you haven't paid any of your bill. Is it that collection mode? You talked about going to collections. So that eventually goes to collections, then what happens? I mean, can they still come in for treatment?
Yep.
Really?
Yep. Even then, that's when even before then, we're gonna do a little financial counseling. We're gonna try to reach out to you and see if there's anything that we can do to help you. We have struggled with the workflow on that because we are a smaller staff.
Sure.
But we are working on that to try to reach out to people, especially those with the larger balances. We know that it's difficult. We know that things happen that are expensive. Healthcare is not cheap, especially with those big injuries. So we understand, but we don't want you to go without. So we want to reach out.
And in the past, there was a time where that was different, right?
Correct.
Can you tell me about that?
At one point, before the hospital owned the clinic, that was a thing, where if you did have a bad debt or you owed the clinic money, you couldn't come in and make an appointment. You couldn't be seen there. That's no longer a thing, and that hasn't been a thing for quite a while. Unfortunately, our community hasn't learned that, and it's going to take a little bit of time, so we'd like to get that word out that you can come in and see a doctor anytime, as long as you give us a call and we can get you on the schedule.
Well, that's why we're here, right?
Right.
You know, and in my experience with collections, you know, it's really about communication. And,
Correct.
you know, I think what I want folks to know is that if Kim calls you, you know, she's trying to help you. She's trying to work with you. She's not trying to threaten you or make you feel like she's chasing you down. She just wants to prevent it from going into collections so that you know, because once it goes to collections, there's not a lot you can do for that person anymore, right? As far they can still get treatment, but there's not a lot you can do as far as working with them on the payment.
Well, even once it goes into collections, I still try to work with people.
Really?
It's once it hits that legal point that I can't do anything. But even once it gets into collections, I've tried to work with people.
Well, Kim, you are a kind soul, and we appreciate that. So, even if I owe you money, even if I've got bad credit, even under really the most dire financial situation, there's a path. There's a way to get treatment, and you're going to help me if I'm sick or if I'm injured. We should come see you.
Right.
You know, that's just great information to have. That is really good to know because I truly think that is a barrier to treatment for a lot of people. Yes, ma'am?
I'm going to talk about Wellness Wednesday real quick.
Great.
So this is a program that we are probably on our second year of doing. It used to be Wellness Wednesday and Fasting Friday, but it's just Wellness Wednesday. Every Wednesday, we have the option of doing lab draws. And it'll either be 6 to 8 in the morning or 4 to 5:30. Just kind of depends on the Wednesday in the week. Why we did this is that there are people out there with high deductibles, and then there's no insurance, people who do not have insurance. But this is their ability to get lab at a discounted rate. So we don't need a physician order for it. We don't bill insurance, and these lab results will go to your portal, which is a patient portal that you can get online and look at. If you're not computer savvy, we can print one off for you. But the reason we went this way is not only because these high deductibles are $10,000, so you're paying a lot of money for labs, but we're also finding that insurance companies are kind of dictating what you can and can't get, like a yearly physical. They used to say that you could get lipids checked every year. Ashley gave us some bad news that it's no longer that. They're almost saying like every 4 years. And I'm not going to tell you all the insurance is, okay, 5 years. That's a long time, especially if you're already on a statin to try to lower your cholesterol. So we have this service available. You just have to call our lab department, and it's quite a bit of a discount for you to do this. Then you would have to take those lab results to your physician.
And what type of lab testing is available?
Yep, so we do a CBC, which is a complete blood count, a complete metabolic profile, which is all your electrolytes. You can do your lipids, so your cholesterols, and then a TSH, so your thyroid. We do another one. Thank you. And vitamin D. The vitamin D is the only one we don't do in-house. We send that out, but a lot of people are very interested in kind of monitoring their vitamin D. A1C. And a hemoglobin A1C. And did you say the lipids? Mm-hmm. There is a flyer out in the thing, so afterwards, if you'd like to, pick up the flyer.
And just so you know, like the lipids, your insurance, they'll only pay for it once every 5 years for screening. If you have a diagnosis, your insurance isn't going to deny it, but it's going to go towards your deductible. So if your deductible's met, you're in great shape. But if it's not met and you have a super high deductible, that's kind of the reasoning, like Aaron said, behind the Wellness Wednesdays.
So once you get out of once you have a diagnosis, you're now out of that realm of preventative care, and it becomes treatment, essentially. So it's billed differently.
Yes, and that's more for the commercial insurances, so like your Blue Cross. Once you get to Medicare, they will cover your labs if you have a diagnosis. So it gets very confusing. So if you have any questions, you can call me and I can look at it and we can kind of go from there.
One thing I want to really stress on Wellness Wednesday is it is alternating. 1 week it's early in the morning, 1 week it's later in the afternoon, and it's not going to switch around just because it's more convenient for you. It's when you call and make an appointment, you can figure out which day is going to work for you, but you got to go with the hours that are there. And it really does have to be by appointment. We do not take walk-ins for the Wellness Wednesdays. We're offering it at a huge discount, and it has to be outside clinic hours, and there's some regulations we have to meet in order to be able to do it. So just please be understanding with our staff when you call and say, I'd like a 6 a.m. Wellness Wednesday tomorrow, and they say, I'm really sorry, but this week it's 4 to 6, and you had to call us 24 hours in advance. Please be understanding of that.
Well, get to know these faces, because I think we're all going to be there on Wednesday with our sleeves rolled up. So,
Just call and make an appointment.
well, we can't. It's Tuesday, so we'll try for next week. You guys have mentioned several different types of care. I've heard you say long-term care. We talked about urgent care. There's emergency care. Can you tell me about the different types of care that are available here in our community? What do we have here in Fairbury for types of care? And I told you these would be hard questions.
Well, I am going to go off of the people that I'm looking at in this room. We have Jason Trim back here. He is in our home health department. Becky is our administrator of our assisted living. And then we have Cottonwood Hospice here with us, with Terry Black. Am I missing anyone? So while Cottonwood is out of Beatrice, that is one of the groups that we use a lot for palliative care or for hospice. But in addition to home health, that department also does occupational health. So I think that's also something that's fairly new to this community. But for all those businesses out there who want to run their employees through a kind of a wellness program, whether it's a drug screen before work or, if they have an accident on the job or labs prior to. And then we also do a physical capacity profile testing, which just kind of matches your physical capability with your job. So both of those. Yes, so our therapy department, which that will also be a topic that we could certainly bring in here. With our therapy, we have physical therapy, occupational therapy, speech therapy, and pediatric therapy. So all of those, obviously with our wellness center, we have the pool, so we can do water therapies also. And I know there's just like a ton more. And then we have Gardenside, which is our long-term care facility. And sometimes you see kind of a nice co-op between Cedarwood and Gardenside. If a family member goes into Cedarwood, sometimes there's a spouse in one and the spouse is in the other. And we just try to make accommodations so they can be close to one another. Obviously, our emergency room care. David has talked about urgent care a lot. Our community does not have what we consider urgent care. You kind of hear about those facilities in Lincoln. I think Beatrice has an urgent care. It's kind of that in-betweener between kind of a clinic and an ER. We're just not set up necessarily for an urgent care. It might be something we think about down the road, but that is not something we have. That's why I think we really try to explain to people whether or not what they think might be an emergency truly is an emergency, or it can be seen in the clinic. Yep, the same day appointments. Because I will tell you, just in the situation today, we had a patient who made an appointment at the clinic. They went in to see their primary care physician, and then they soon brought her over to the emergency room because her heart rate was in the 40s. So, you know, this was a patient who tried her darndest to go to the clinic, but she was going to need care that was beyond the level of the clinic. Yes. So our hospital is considered a critical access hospital. Some people don't really know really what that means, but it's how our bed size, it's how we get paid. It's a little bit different than like the Bryans and the St. Elizabeths. But within our program, we're able to do a swing bed. So swing bed would be for patients who have stayed in our facility in an acute status for 3 midnights. And then they can stay for an extended period of time as long as they meet criteria, either for therapies. Let's say they have IV antibiotics, possibly a wound that we're monitoring. And a lot of times these people just are in our facility just for some rehab until we can get them back home. We've had someone stay in our swing bed for as little as 3 days, up to the full max of 100 days. So once you hit Medicare, Medicare pays for 100 days of skilled care yearly. And so we've had people take full advantage of that. As long as they meet that criteria, we are able to approve to their insurance that they're progressing and they can stay with us, or we may move them over to another facility that provides skilled care. Gardenside does. Heritage does as well.
Wonderful. And that leads me into my next question, which is, can we talk about the limitations of the care that's available in our community? So at what point do we need to consider, or do we need to, I guess, refer people to a larger city, Beatrice or Lincoln or Omaha, because we can't meet those needs?
Great question. And I like to kind of touch on our helicopters at this time, because I think everyone who watches Facebook always like, oh my gosh, helicopters. Helicopter service is a phenomenal option in rural communities, and I'll get there in a little bit. But Bryan Hospital is our network hospital, so we often, I would say maybe 80% of the time, do our transfers to Bryan. And why we would need to do a transfer is what we call a higher level of care. So we can do a lot of things in the emergency room. We can do pretty much all scans, CT scan, x-rays. We can do a lot of labs. Some of our labs we send out to the med center. But then once you need that next level up, such as a specialist, that's when we're going to transfer you. For example, if you come in with chest pain, we're going to do all the tests to find out if you're having an acute heart attack. If you're having an acute heart attack, we're probably flying you out. because our goal is from the time you meet our door to be in a cath lab within 90 minutes. So hence a helicopter. Can our ambulance get there? Absolutely. They're probably booking it. But there are other reasons sometimes we fly. If we have a patient who is just a borderline critical and there's concern maybe they'll decline during the transfer, oftentimes we'll choose to go air because of their level of expertise. There might be situations where our ambulance, we don't have a huge ambulance department, but we're very fortunate we have what we have because there's a lot of communities that don't have one. They may be busy. They might be out on a transfer, but they might have 2 house calls where we have to use an ambulance to get somebody transferred. Other things that we usually transfer up a level of care would be a stroke. Stroke care, the goal with stroke is that we know right away whether or not you have a clot versus a bleed. And the clots, well, both can be treated elsewhere, but the clots are where they can go in and do kind of a clot buster. And so really, ideally, it's to get you to one of those hospitals that can do that. The other case is sepsis. I'm going to get on my healthcare thing. Sepsis is huge, and I don't know if people really understand what that is, but it is when you have an infection, and not even sometimes an infection, but it has overwhelmed your body, that each of your organs are already kind of feeling the effect of it. And we can identify that in our ER by your vital signs and a few laboratory results. There are some cases where we can keep you in our facility. The big thing is IV fluids, antibiotics. But if we sense that you could decline, again, those are ones that we're going to send you up to Bryan, St. Elizabeth. And recently, I will tell you, if you have a family member that says, oh, I'm going out to Kearney or to Grand Island or Omaha or Fremont, that is because there's not a lot of open beds in the state of Nebraska. I don't think it's a Nebraska thing. I think it is sickness. I think it's our staffing crisis that we're going through right now. For example, Bryan, they closed entire wings of their hospital. So if you don't have the staff to take care of people, you have to close those areas so that you're providing the best care. So we have utilized hospitals in Kearney and Grand Island, so we've flown some recent ones out there, and they provide just as great care. You just don't hear about those because we often just send our patients up to Lincoln.
But I think it's crucial, the same level of care can be provided at those hospitals that can be provided at Bryan.
I grew up right by Grand Island, and I didn't know that they had, a neurosurgeon team that just did a neuroblastoma tumor removal on a family friend, and that was in Kearney. So there are those specialists in all of these cities that, sometimes we just don't realize that.
Well, I think it's important probably to caution against self-diagnosis here, right? If you're having chest pains, don't think, oh, they really can't treat me here, I'm going to drive myself to Lincoln. Still come see you, and you will make the determination on how best to transport that person.
Stabilize them, correct? Yes, we will stabilize you. And another thing that I might just add with transfers, we do have, some of our providers will ask families. If a gentleman comes in and he's in his early 90s and he is having an acute heart attack, our provider will ask, is this something that you want to go to Lincoln? You want them to do everything you can? And there are certainly some people who said that say no. I'm 95, I've lived the best life I can. I would rather stay in Fairbury so that my friends and family can come in. And I want people to realize that, because just because you're having these types of events, people can choose. We are in control of our healthcare. They can choose not to be transferred. And we have had situations where that's come up because their family's here. They want to stay here, so.
Excellent. And can you touch on that just a little bit more? You talked about patients' rights, and not just patients' rights, but patient responsibilities, because you also mentioned, that yes, we can help you, but you have a role to play in that. So can we talk a little bit about that partnership between you and the patient, whether it's patients' ability to advocate for their own care or their family's care, but also their responsibility to follow a plan of care and do their part to financially and health-wise to
I've talked way
follow
too
the plan.
much. I'm going to pass this over.
Okay.
Somebody can.
So yes, so a primary care provider at the clinic, they can give you the tools that you need, the recommendations that you need, but ultimately you are responsible for your health care and to follow those instructions that your provider gives you. And to work with them, ask them questions, follow up if you don't understand something or the plan isn't working for you and you guys need to look at another route that works for you, because not everything is the same patient to patient. Everyone has a unique situation and a unique care plan.
And is it okay to speak up if you don't agree with either a diagnosis or a treatment plan?
Yes, if you ask questions, just communication with your provider is very important.
So much boils down to communication, doesn't it? Well, speaking of communications, that's all the questions that I have. But now you have the opportunity, if you'd like, to ask any questions that you might have of the panel. So if you have a question, what we'll ask you to do is to come to this microphone here so that everyone can hear the question. And if you are unable to come forward, just put your hand up and we will get a microphone to you one way or another. Does anyone have any questions that they would like to ask the panel?
Hey, Dave, while they're thinking, I do have one thing that I think we
Please.
missed. When we were talking about all the different types of care available here, we have a very robust set of outpatient services. There's a flyer out in the fellowship hall that gives a list of all of the specialists who come to JCH&L. But there are specialists there many days out of the week, and sometimes there's 3 at a time. There's not every single specialist you could ever imagine, but there's a good list of specialists. And those folks come from Lincoln or wherever, and they're here to see a number of patients. So just as an example, I think when the GI specialists come down, we do about 16 procedures in a day. And that's colonoscopy or EGD, where they go down your throat to look at things. And that means that you can come right here to town, you can have your procedure, and you can get back home and not have that long drive to deal with. So the outpatient specialty clinics, I think, are also really important to note. And we have added quite a few of those in the last 2 or 3 years. So, and we're always looking for ideas of other ones that might be important to our community. So if you have ideas, Dr. Burke Klein is our CEO, and he's sitting right over there, and he would be a great one to tell.
There you go. Now, folks, you don't have to ask any questions if you don't want to, but if you don't ask questions, they get to ask you questions. So,
I got a question.
please, could you please approach the microphone?
Insurance companies dictate what we do anymore. So what do you guys think about telehealth?
Is that
They're pushing
telehealth?
telehealth.
So the question is, insurance companies dictate so much of what we do. What do they think about telehealth?
So there is certain insurances that do still cover telehealth, which is where you talk to your provider via your computer.
No. They give you a number to call.
Oh. Well, my opinion is I don't like that because I would rather you come to the clinic and we treat you and take care of you where you have that relationship. You trust that provider. They know you. They know your history. They know what medications you're on. They know your allergies. I think that's a much safer and more complete approach.
Well, I think it goes back to what you were saying about the importance of that primary care provider. Using something like telehealth, you're communicating with someone that doesn't have that information in that chart. So,
Right.
right, so it becomes very difficult. So that makes a lot of sense.
And to add to that, we did see a couple of marketplace plans last year, and I think there was one that tried to pop up this year. Do pay attention if you're shopping on the marketplace. They do pop up with virtual only plans where you are assigned a virtual provider that you have never met, they never see you, and in order to be treated by someone locally, you have to go online and request permission from your virtual provider. Otherwise, your care is not covered and it becomes 100% patient responsibility. I helped several patients last year with some bills that they were unaware that they were going to get because they didn't realize they had to ask permission to be seen by an on-the-ground provider, is what they called it. So do pay attention when you're shopping for insurance.
Wow, that is great information. Did they answer your question, sir? Fantastic. And one of the forums that we will almost certainly do in the future, probably when next year's open enrollment comes around, will be a forum on healthcare coverage and how to best navigate that. So, Landon's about to beat me down.
Kind of related to that, we do have about 3 specialties who come to our outpatient services who don't come physically. So the one that pops right to the top of my head is the nephrologist, and I can say that I was with someone who had an appointment with a nephrologist there. So we have a nurse who's in the room who takes the blood pressure, who does anything that the doctor needs. The person can then have the visit with the nephrologist. And, you know, if you think about a consultation with a specialist, you're probably talking about 15 to 20 minutes in most cases. This was a follow-up visit, and the person I was with, it allowed them not to have to make a trip to Lincoln and back for a 15-minute visit with the nephrologist. And the screen is right there. You have clear view of each other. They had a great discussion. So there are some good places for telehealth, and sometimes that it can actually be helpful.
So under the guidance of your primary care or your specialist, and yeah, it sounds like there are some times that maybe that just makes sense. Excellent. Are there any other questions? Anyone have any other questions for our panel? Yes, please. Please come to the microphone.
Okay.
I don't like those air quotes.
So, because of our contracts, I do have to be a little careful with what I say. What I usually tell patients is take a look at your own health, and then take a look at the health of your immediate family members, your parents, and then take a look at the health of your grandparents. How long did they live? Did they have chronic illnesses? Were they in and out of the hospital? Did they have a lot of expensive health care bills toward the end of their life? If they didn't, if they were relatively healthy and lived a long, great life, that is awesome, because then, yes, maybe Medicare Advantage might be something good for you, because there are lots of perks to it. However, Medicare Advantage is limited for those who have a lot of chronic issues. If you are in and out of the hospital, if you have long stays in the hospital, for example, United Healthcare only covers four nights in the hospital. Just 4, that's it. No matter what, they'll cover 4. So that's it. It's not for everybody. If you have chronic issues and you're on a lot of medications, you have a lot going on, please do your research. Please make sure this is something that is going to take you into not just the next 5 years of your life, but into the end of your life. because Medicare Advantage might be great when you're 65, not so much in your 80s and 90s.
4 days. When they say get well soon, they mean it. You've got 4 days.
They're not kidding.
Oh, please come to the microphone to make it, please.
The Advantage Care, I have just recently gone through a nightmare with my mom over that. And you all probably have heard of her, that she broke her femur. She was in Cedarwood, living there for the last 4 years. And she's had a couple of falls and everything, but this was a bad one. And they had to transfer her up to West, whatever, I'm sorry, I'm falling.
Right, it was Brian West.
Yeah, and she had to have immediate surgery on it. She's 95 years old, and they wanted to dismiss her after 3 days, and it just blew my mind. And somehow, some way, between your hospital and the people, Becky and people at Gardenside, they worked with the insurance company, and somehow, some way, she stayed there for 8 days and hasn't been billed or anything, but it was through the works of you guys that got her to stay there. So then we get her back home, and she has to go into Gardenside. And they told me last Friday that as of 6 Sunday night, Mom had to leave the facility or whatever. And they don't call until the day before or a weekend. And I've heard over and over again, they say that they do that on purpose. And so I call my brother, and he's the one that does all the insurance and stuff, but hers is an advantage also.
Yep.
But I do want to say, you guys are amazing. You have helped my dad through hospice. You have helped my mom stay at, I think she'll make her 95th birthday, which is in May. But everybody is so caring, so loyal to her needs and everything. And she's not easy. She is not an easy old lady. You know, she's telling them what she wants for medication, and they're supposed to give it to her, you know. But I just, God bless you all in this whole facility, and you've done a great job.
Well,
Well,
thank you.
she's one of my favorite people, and I know she said a lot of things that are. I know she gave a lot of personal, identifiable information there, so I know you'll need to be restrained in anything you say. But I think the main message is you're amazing and thank you.
And Ashley did remind me that I do have to throw out a caveat. I did mention that, yes, Medicare Advantage may look good when you're 65. Keep in mind that if you do decide to go with a Medicare Advantage plan, if you try to go back to traditional Medicare, you are not guaranteed a supplement. So not only would you have to pay your deductible, but you would also have to pay your 20% coinsurance that Medicare does not pay. So you would have a lot of money coming out of your pocket if you go back to traditional Medicare.
So you can't really change at 95.
Correct. You probably would never be able to afford to go back to Medicare later in life.
Well, folks, that's about our time with our panel. So I would invite every one of you. We are having refreshments, once again provided by our generous sponsor, in our fellowship hall, which is the room right behind the sanctuary here. Our panel, I believe, is going to join us for refreshments, so they will be in there, and if you have any other questions, you can certainly ask them then. But I would like to thank you all for coming out here tonight to this first forum. We have many more that we're going to do. I can't announce them just yet, but please watch our Facebook page for announcements about those, and we'll get them out there as best we can, and I hope to see you at all of them. Thank you so much for being here tonight.
Can we
join us
please
in the
give
fellowship
Dave and the First United Presbyterian Church of Fairbury a big round of applause for hosting this? It is an awesome thing for our community, and we want to see it be successful as you go month to month. So thank you for hosting it.
We love this community, and it's our pleasure to do it, so thank you. Let's get some food. Thank you all. You did such a fantastic job. Really appreciate it, guys. You betcha. Thank you. Yeah. Thank you. Yeah, I think that is quite all right. Most of the panel will be here, so we'll be good.
Yes, it's a 1 point difference right now.
Oh boy.